essentially part of a series of videos we're going to do to inform you guys about some of the procedures that are done in facial plastic and reconstructive surgery. So what is a facelift and what does it address? So before we understand what a facelift is, the first thing we need to know is what happens when we age, and especially what happens to our face when we age. What happens to our face when we age is that the laxity of our skin starts to go away. And that happens because certain chemicals in our skin that keep everything holding up, like elastin and collagen, start to break down. They break down for various reasons, either because of your genetics, just because of time and aging, or because of sun damage, smoking, and other factors that contribute to increased aging. As they break down, our skin starts to loosen and sag. The muscles weaken a little bit as well, and as they weaken, the skin loosens and sags further, and you get visibility of the fat that's under the skin. So you'll get jowline, sort of the little hanging of the corners of the mouth that hangs along the jawline. You get your mid-face or your cheeks to come down. You'll get bulging here, deepening of these lines around here. This happens throughout our face. You'll get wrinkles in your forehead, your eyelids and eyebrows start to sag, and you get wrinkles around your eyes as well. What is a facelift? Facelift is the surgical procedure to correct the effects of aging that happen to your lower third of the face. What do I mean by that? Well, your face is generally divided into three portions or thirds. The upper third includes your eyebrows, your forehead, up to your hairline. The middle third, which is basically where your nose is, your eyes are there, your cheeks and mid-face are there. And the lower third, from the base of the nose down to the chin, and then the neck region is another part of your face. A facelift addresses the aging of the lower third of their face, and it can be combined with a neck lift for a complete rejuvenation of the lower third and the neck. During the facelift, we lift the skin off of the tissues underneath it, we identify the muscles of the deep planes of the neck, and we'll elevate and resuspend those muscles to where they naturally were. Then we bring the skin back, remove any extra skin, we suture all of that together. A facelift incision for this reason is generally hidden nicely in the hairlines, around the ear, behind the ear, and if we're including a neck portion, it goes into the hairline back there as well. With these incisions, we get a natural result that hides well, scars aren't visible, you get a rejuvenated look to your neck and face. Now, facelift doesn't address the middle portion or the upper portion of the face. To do those, there are other surgeries that we'll talk about in later videos. Facelift recovery generally takes about a week to 2 weeks. You have sutures that come out, and once they're out, you typically look pretty good. But there is some swelling that happens under the skin that needs time to go away completely. That process by itself can be somewhere around 2 to 3 months for you to feel like most of the swelling, the lumpiness that you may feel goes away. Now, you won't see these, but you'll definitely feel them. And a facelift will age with you. So it doesn't stop the process of aging. Once you do a facelift, you're not that way forever. It'll continue to age with you. Over time, as you age, you'll continue to get sagging of the skin, you'll continue to get dropping and drooping of certain features. And so sometimes people may need touch-up procedures that aren't quite as extensive as the first time, but by doing so, you'll continue to maintain your youthful appearance. If you want to know more, if you want to see if you're a candidate, please call our office, make an appointment, come see me, and we'll talk together. See you guys soon.